Real Country 1430 AM and 107.3 FM WRDN. I'm Brian Winnekins, and joining us today is Pepin County Health Officer Heidi Stewart. So we get an update on the COVID-19, also the vaccination progress as well. And Heidi, thank you for joining us today. And for those of you listening, we'll also have this posted on our YouTube channel at Duran Broadcasting, WRDN. So Heidi, first, I know we've seen a bit of an uptick in positive cases here in the county.
Yeah, so overall, the numbers have been very, very good, and we've seen a steady decrease since the beginning of this year. I'm going to go ahead and share just kind of an infographic here, or actually just a graph of cases and what we've been seeing, and you can see it on here. Let me go ahead and do this quick. This shows you, for those that don't have the computer and aren't seeing it, it kind of shows a little blip in July. And I remember when we thought that was really, really busy. And then it shows the cases through the fall and how busy we were. So it also then shows a steady decline since the beginning of the year. However, if you look really close at it this week, we had been really quiet for a couple weeks where we didn't see many cases at all. Unfortunately, this week we had 12 cases that we're following up on. A lot of times people wondered, way back in the start of this, people wondered, well, where did those cases come from? You know, what's happening? I thought our numbers were going down. Where are these cases coming from? And this is just really good evidence that we're not out of this yet. There still continues to be COVID-19 lingering out and about. Some of these are husband and wife pairs where a family member or a friend might have come to visit, or they might have went themselves somewhere to visit and then were exposed and are now testing positive. We have not had any cases in the schools for quite a while. And this week we have 2 cases in the school, which one of the cases is excluding an entire elementary classroom. And then the other case is resulting, I shouldn't say is excluding, is resulting in the quarantine of an entire classroom and is resulting in the entire quarantine of a one, not a classroom, but one class that student attended. So we are still seeing some numbers. The good news is we don't have anybody right now that's in the hospital. The good news is we haven't had any new deaths, but it is still out there. And that's one of the hot topics that I have to address actually quite frequently. And I don't know if I'm still sharing my screen or not.
Nope, we're not seeing it now.
Okay. Let me go ahead and share this. Now is definitely not the time for us to stop what we're doing. Yes, we're getting vaccine into people's arms. Yes, we're getting people vaccinated, but we are very, very far from herd immunity. We haven't been able to vaccinate anybody under the age of 16. There continues to be new strains and new forms of COVID that are coming out. What I've been reading mostly is that some of the new strains are actually more transmissible. They spread more easily. So along with that, and then just the fact that this is a new virus and we don't really know that much about it. We don't 100% know how long the antibodies will stay in your system after you have the illness. And they really don't know how long the vaccine will be good for and whether or not you're going to need a booster at some point. Right now, some good news that came out this week from the CDC is that they updated their guidance to say that following your second dose of the COVID-19 vaccine, if you are exposed, previously you would have had to quarantine. But if you've had 2 doses of the vaccine and you are not showing symptoms, you do not need to quarantine. So this is going to be huge when we get to some of those essential essential workers, to educators, to daycare individuals, which we've been told that we can maybe start to move to them on March 1st if we're in a good enough spot to be able to do that. Healthcare workers now, if they're exposed, they have that 3-month window where they don't have to go back. Yes, it's only 3 months. The reason it's only 3 months is we don't really know how long the vaccine efficacy will remain at the level it needs to be. We may hear in a couple months that, hey, you know what, it's looking pretty good. Let's move that up to 6 months. We just have to wait and be patient.
Talking with Pepin County Health Officer Heidi Stewart this afternoon. Heidi, speaking of the vaccines, I know that the health department's been doing vaccination clinics in Pepin and in Durand. Tell us how those have been going.
Yeah, so I'll apologize. I have not been on the call here for a couple weeks, and it's been because we've been very busy trying to get vaccines into arms. And I want to thank Debbie from the Courier Wedge for the article she had out last week or the week before. It really captured the mass clinic efforts very well. So the process right now is for the health department and other vaccinators within the county or within the state to submit a request. Those requests all go into a system where they go through a formula, and based on a whole bunch of variables, out of that formula comes the weekly allocation that specific vaccinator will get. We still know that the state of Wisconsin is only getting about 70 doses a week. They're 70,000 doses a week. They're looking at that number increasing quite steadily over time, but still not as fast as it needs to be to meet the demand. Our demand is far outweighing our supply. Here in Pepin County, early on, we were ready early, and with the hospital system being ready to vaccinate, with Heidi Pharmacy being ready to vaccinate, we saw some really good things the first week. And actually, I'm going to flip over here to share something with you. Oh, I already am. Sorry. So here is something that was released this week, and it's data on vaccine in the state of Wisconsin. So for those listening in, this is a color-coded map. It's a heat map. So the higher the color, the darker the color, the higher the vaccination rates are. And Pepin County is a bit higher than the rest of those within our region. The state of Wisconsin appears to have vaccinated 11% of the population. The orange, 11% of the population that has been authorized. So right now we're in the healthcare workers, we're law enforcement, we're fire, we're EMS, we are 65 plus. So about 11.5% of that group has been vaccinated for the state of Wisconsin. If you go to this map, which is on the DHS website under COVID-19 vaccine, you can specifically click on Pepin County, and then it will pull up Pepin County specific information. So of the population for whom the vaccine has been authorized, Pepin County has 1,100, just very, very close to 1,200 people that fit into that category. 16.3% of those people have been vaccinated. So we do still have a percentage that we have to get more vaccine to. It further breaks it down by age. It shows us that of the 65 plus population, we have vaccinated 50% of those in Pepin County. It shows the male and the female uptake, and then it also breaks it down by race and ethnicity. You do see on here that a certain percentage of our 18 all the way up to the 64 have been vaccinated, and it's most likely because those individuals fit into that 1A category along with the law enforcement and fire. So that's where those percentages are coming from. Overall, this is a good number. We're very happy with where we're at, but we're not satisfied. We're going to continue to be aggressive as possible in ordering vaccine. Right now, we're getting about 100 doses a week, and that's where I wanted to bring up this lower portion. So these are the amount of vaccine doses that are administered to Pepin County residents each week. So you'll see early on, somebody in healthcare must have been getting them, because we did not start as a community here vaccinating at Advent Health till about right in here, middle of January. So we started to get the doses here. And then January 24th, we had our big clinic, and Advent Health also got some, and Heidi Pharmacy also got some. So the week of January 24th, we vaccinated 733 people, which was a really, really good week. You can see that those numbers dropped the following week, but the only reason those numbers dropped was because our allocation for our county dropped. We can only give what we get. And then here for the week of, it shows February 7th. It only has 46 doses entered yet. And I know that's not right, because we did 100 today. So we continue to order, and it appears as though we're going to be continuing to get, I'm keeping my fingers crossed, approximately 100 doses a week. So if that's the case, we'll, we wait until we know our allocation, and when we see that confirmation in there, we go ahead and look at our wait list on our website, and we start to call people, or we start to email people and schedule them for those 100 doses. So far, we've been doing a clinic in Durand, and then we did a smaller clinic in Pepin. Then we did this week, we did a clinic here again in Durand, which was a smaller one. And then we'll go back to Pepin next week and do a smaller clinic in Pepin. So that's kind of how we're going to do it until we see, based on our wait list, that the demand is different. We'll do it different. If we look at our wait list and it doesn't appear that there's a need for us to go to Pepin to do it, that we need to stay in Durand, then we will stay in Durand. We're not, I'm sorry, we're not limiting people. So don't think that just because you live in Durand, you have to go to a Durand clinic, or just because you live in Stockholm, you have to go to Pepin. That's not the case at all. And I would encourage people that if we call you, don't wait till we come to your town if you really want it, because we really don't know what we're going to get the following week.
Talking with Pepin County Health Officer Heidi Stewart. Now, Heidi, okay, so on the 24th, or the week of the 24th, we had the 724 vaccinations. Now that is just the first round. So will there be 724 second round here coming up 28 days from that time? I mean, is that already there, or is it all of a sudden going to be, wow, we're sorry there, Brian, but we didn't get an allocation, so you're not going to get your second dose?
Yeah, and that's actually something that I'm really, we're watching that pretty carefully. We have been promised that they were sending it 2 weeks early, but now they're sending it the week of. So we are due now. I'm looking really quick at the map. So those first doses were done January 30th. So we are returning to Caddy Woodlawn School on February 27th to do those second doses. That week, because we know we're going to be giving 300 doses, 300 plus doses at the school that day, close to 400. We're going to try to lay as low as possible the rest of the week. If we're able to get that 100 dose allotment of vaccine, we'll probably host a small clinic somewhere. The last 2 clinics we have been 100 dose vaccine clinics, and we've been able to move through those in an hour and a half. So with the volunteers we're getting and the setup we have, we're able to get people in and out fairly quickly. I don't really foresee us until the future, like months down the road, maybe getting allocations again, like 400 doses. I think for the near future here, it's going to be 100. So these smaller clinics, I don't want to burn out staff, and I don't want to burn out our volunteers. So we're watching that schedule very closely. So The first doses will come, then we look at 4 weeks from there and make sure that we're going to have the capacity to do that. So far, we've been promised that those doses will come, like I mentioned, and they will automatically come. We don't need to order them. They will just show up.
All right. Well, again, Heidi, we appreciate you joining us this afternoon.
Yeah, thank you so much.
And that is Pepin County Health Officer Heidi Stewart. You're listening to WRDN.